March is National Colorectal Cancer Awareness Month, and the Nebraska Cancer Coalition working to increase the awareness about early screening options and just colorectal cancer in general. So we are joined now by Dr. Magana. He's a gastrointestinal physician joining us in Scottsbluff. Tell us, first of all, what is the role of family history when it comes to colorectal cancer?
Well, it's actually the most important, or not necessarily the most important, but it's one of the strongest risk factors for colorectal cancer. If you have a first-degree relative, in other words, a parent, a child, or a sibling that has colorectal cancer, your risk is 2 to 4 times the average risk of developing cancer.
Dr. Magana, you think about somebody who might not be 45 or older. We've heard that 45 is when you should get tested, but if they haven't hit that mark yet and maybe still be experiencing some symptoms, what do those symptoms look like?
Sure. There are several. One of the things that people have to realize, though, is that early colon cancer really is asymptomatic. But if you start to have symptoms, then the most common thing is like blood in the stools, changing the way your stool habits look if they become more frequent, less frequent, change in shape. Those are the main ones. Abdominal pain, although abdominal pain is usually a late sign, but those are the big ones. Unexplained weight loss is also one.
Excellent. Okay. So we talk about some of these screening options when we hear about colonoscopies a lot. What are the screening options?
Okay. So well, the gold standard is a colonoscopy. That's the one that you really want to do because two things happen with that. One, you can actually visualize the lesion, and if it's small enough, you can actually remove it. So it's both not only a diagnostic tool, it's a therapeutic tool. We can get rid of lesions that potentially can develop cancer. But if that's not available, or you're kind of leery of doing that, some other options there are various stool sample tests that can be done. Cologuard is one. A FIT test is one where you send in a stool sample and they look for either blood or cancer cells. Another thing that you can do is CAT scans. Those are the 3 big ones that, aside from a colonoscopy.
Sure. All right. Well, Dr. Magana, the last word is yours. What else is important to mention that we haven't had a chance to touch on?
Sure. The biggest thing that I think would be of benefit if people just aren't afraid of getting this thing done. People sometimes are afraid. They don't want to go in because they're afraid of what they might find out. But colon cancer is curable if you catch it early. So don't be afraid. Go in, do the test that needs to be done, and might save your life.
Excellent. All right. We appreciate your insight. Thanks so much for joining us.